Welcome, David. So happy to have you on the Leaders Who Care series. Thanks for joining us.
Hey, Mark, I'm excited to be here.
Yeah, it was great to meet you at the Lake Nona Impact Forum, and so many insights, so many things going on in your arena that I'm really appreciative of being able to share it with our audience as well. And always the best place to start is if you could briefly. I tell this to men mostly because the first place they go is they say, "My position is." If you can tell me a little bit about where you're from originally, where you are now, your family, very personal, intimate stuff, things you've never told anybody before you want to reveal now, stuff like that.
Okay, so my position is I'm a dad and a husband and a son and a brother, and I guess sisters-in-law too. So family is crucial to me. I've been married to my wife, Andrea, for 30 plus years. We met in med school. We have two kids. Our daughter Rachel's actually getting married in about a month. That's our first one, 31, and Ryan's 28. Grew up in California, actually third, fourth, fifth, now sixth generation Northern California, but live in Southern California. What have I told that I haven't told anyone else? You know what? I'm an open book. I probably have no secrets.
Well, good for you. I got three boys and a daughter-in-law, and she's my favorite by far, by the way. And my middle son is actually getting married this summer as well.
Congratulations. I'm actually the middle of three boys as well. So there you go.
Nice. Yeah, not to get too far off, my daughter-in-law's from Denmark, and she told us something a little while back that keeps coming up. They don't say stepmom, stepdad, stepbrothers or anything there. They say bonus moms, bonus brothers.
I love it. I love it. Canada calls immigrants new Canadians.
I like that too.
It's just important words that we could learn here in the US. Something I've learned in healthcare is you go around the world and you see these things that are so cool and you're like, God, we should do that here. And the same with all these. A lot is to be learned outside the US.
Oh, no doubt. And it really, to your point, those little words, because step in movies is always perceived as an evil thing. So if you change it to a bonus or new Canadians or stuff like that, it really does work with us.
Yes.
So cool stuff.
Maybe I'll work that into the father of the bride speech that I'm working on right now for you. Not a new son-in-law, but a bonus son. Oh, I love
it. Well, if you need somebody to proofread, let me know.
Okay.
So speaking of kids, what were you like as a kid, teenager? Were you like the lemonade stand guy? Did you play doctor, sports? What were you like?
So I was always. Well, my wife says that I should have grown up and been a camp counselor. So when I was little, I said I want to grow up and be a pediatrician. Now, I didn't come from a family of docs and I wasn't sick. I don't know why I said that, but I was interested in science. I was also kind of interested in leadership when I look back now. So I was like student body president of my middle school, my high school. Like every time there was that kind of an election, I ran. I don't know what my platform was, but so maybe it was more about popularity. But I wouldn't have called it that back then, but I loved leadership and I loved science and I loved being silly.
Which involves curiosity, probably.
Yes.
Very cool.
I think I did have a lemonade stand, but I wouldn't describe myself as the lemonade stand guy.
Right. That's good to know. We won't categorize you as that. So then, early on, you started, this is interesting, with economics at UC Berkeley. Then you went on to Chicago Med, not the TV show, but actual Chicago Med. And then an MBA after that at Pepperdine. What were you envisioning for yourself even before you had a comprehensive background with UCLA Health Organization?
Yeah, I don't know that I had any idea what I was doing. So the reason I got into econ at Berkeley was I was pre-med and you needed to take some classes outside your major, and I took an econ class and the teacher was spectacular. And I was like, that's what got me interested in the econ. And then when I was at UCLA on faculty, I was about 4, 5, 6, 7 years into faculty position there. There weren't a lot of doctors getting MBAs, but I thought, wow, this would be great. And we actually had a family meeting. So now we had 2 kids. They were way younger. And I said, look, Dad has a job. It's good. Maybe they were 4 and 6 or something like that. And I said, hey, if I do this MBA, it's going to take me away a little bit from the family. So I think we should have a family vote. And we actually voted, and it was 4-0 to go for the MBA because I thought, I didn't need to do it. It was more, it's just stuff I liked. And then when I was in the MBA, I had this dream that somebody would find me, doc who had an experience for 5 or 6 years, academic, mental health. I'm a child psychiatrist in an MBA, and I'd get plucked out and it'd be this dream job, and they would find me. And what I learned at business school was I was actually in my dream job at UCLA. I just didn't know what I was doing. And the business school gave me the techniques to actually go, wow, I have found my laboratory. And at that time, it was the child outpatient clinic that I was like, oh, I could bring all these things back to my work. So this investment that UCLA made and I made in the MBA, I think really paid off in me being much more, it was the first time in my life I stopped worrying about what was coming next, and I learned to be present and focus on what I was doing. I forgot about that dream of getting a dream job.
It's brilliant. If you know the unfortunately passed away scholar Kobe Bryant, who in his own way was the scholar. He said some brilliant things. He said you should always go for the championship, your dream, whatever that dream is. But what you got to know is the dream is right now.
Totally. So this is probably bad on a video, but I'm going to move my webcam because I want to show you this. So this is when I played Kobe one-on-one, which
Wow.
my wife describes as I was more excited than our wedding night. So I'm with Kobe. I push against him. He double pump fakes. I don't want to go for it, but I jump on the third one. He shoots, looks me in the eye, and goes, "It's going in." It did go in. And then I shot one against him, and I missed. So I lost 0-1, but he said I had good form. So his passion and focus on that presence is just amazing. Amazing.
Yeah, I was really taken by some of the stuff he said. And as he grew more mature, type of thing in his life too. He's just, man, he would have done a lot more amazing things, which what he was doing
Yes,
with kids and
yes.
everything. So, but that's funny.
But there I got my medical diplomas on this side and my Kobe one-on-one on that side. So there you go.
Well, I just interviewed a high tech guy and whatnot, and he showed me his Patrick Roy Canadiens jersey because I'm a big Montreal
Nice,
Canadiens fan.
nice.
So I brought out my Patrick Roy picture and whatnot that I had. So I get it, type of thing.
Yeah.
And when I met Bobby Orr for the first time, not to go too far off here, Brad Park, who's a friend, introduced me to Bobby Orr, and I go up to Bobby, and this is where the kid comes out, and I said, "Oh, hi, Brad." And like I was totally missing who, I knew it was Bobby Orr, but I wasn't, this was Bobby Orr type of deal. So playing with Kobe Bryant, that's big. That's pretty,
It's big. It's big.
yeah.
It's big. Yeah.
You've got to be careful you don't make it like it is bigger than the wedding, but it's big.
Exactly.
So, we found that our firm, Fifth Element, on the basis that leaders in their organizations can do way better when they're doing good. It was the premise, and it's kind of grown, thank God. You're clearly a leader in believing in leaders who care first about the patients, as I heard you talk about at Lake Nona, as well as collaboration and innovation, which then translates into good business results. Can you describe what you learned and also the relationships you developed at previous employers like Geisinger and Google Health and Cerner, how it influenced you, how you capitalized on strategic partnerships, etc.?
So, Mark, I actually think many of my lessons came from home and from my parents. I was blessed to have amazing role models in my family, and also from early on with my patients. And I kind of think in all the different roles I've had, I'm still trying to get it right with a couple of cases. One was this 12-year-old boy, new onset psychosis. I'm just finishing my child psychiatry training at UCLA. His dad is a single dad who sells used Cadillacs in Vegas. Mom left. So you can just kind of picture who this dad is. And I think back then I thought I was super smart, right? Well-trained, I'm at UCLA, blah, blah, blah. And I'm talking to this dad about neurotransmitters and nucleus accumbens and ventricles and anticholinergic. And the dad looks at me and says, "Are you telling me I need to build a room out back?" And I just started crying because we had just had our daughter. So this is about 30 years ago. And I'm like, whoa, the trajectory of this family's life just changed. And that question and talking about that is so much more important about any of the psychobabble I'm talking about. And at that point, I said, okay, I'm going to explain things to patients in a way they understand. I think that has been with me at all these places. Another one was a second grade girl who wanted to tie yarn around her neck. She wrote in her haiku poem to commit suicide. And now I'm in faculty position a few years, and LA psychiatry, you got to know someone to get in. So because they knew someone that got in 3 weeks, and I thought, wow, if they didn't know someone, they probably never would get in. And even if you did know someone, you want to be seen today. And so kind of, I didn't know the term, but focusing on access and same day appointments became kind of something I did. So I did that at UCLA. When I got to Geisinger, we gave money back guarantees for any patient that wasn't satisfied with any part of their care, instituted same day appointments, explained things in a way that people understood. If you didn't understand your bill, you didn't have to pay your bill. Like every single time, it was really these two cases that really helped drive me. Then I got to Google. COVID happened while I was there. When I left Google, because I think the number is much higher now, there had already been 50 billion impressions of our YouTube page about COVID, 50 billion. And I'm like, whoa, we're putting things out in a way that people understand. Like when you think about Google during COVID, it was, can we get authoritative information out to the world that's culturally sensitive, that's local, regional, national? And I was like, that's what I wasn't doing right with that patient, but what that dad taught me that's what people really need. So wherever I've gone, it's been about how do we make care more equitable? How do we get people in faster? How is it you don't have to know somebody to get in? And then how do we talk in a way that regular people talk so that together with patients or families or populations, we can move the ball forward on, achieving better health.
Wow, thank you for sharing that. It's brilliant. And the crazy thing about it is probably the best thing to do for business, if you will, too. Because
yeah, so I always said that, like when I got to UCLA, well, I was UCLA 25 years, but the last half of which I was the chief executive running the hospitals and the doctors and the health system. And I had a great mentor, and he told me, hey, when you take this job, 1,000 things are going to come your way. Just pick one. And I had no idea what I was doing. I probably was not, I know I was not qualified for that job. And the one I picked, it's because I didn't know anything else, was, hey, can we make it better for patients? And we went from 28th percentile patient satisfaction. Now we were rated the third best hospital in the United States, but so this wasn't a turnaround, but we weren't known for being kind or loving our patients. We went from 28th percentile to 99th percentile, top rated hospital among 6,000s on would you refer us to a friend or rate us on a scale of 1 to 10. So it was this experience. I had an amazing team where we literally changed the culture from, I say kind of joking, like, UCLA's mission statement back then was, we're great, aren't you lucky you get to see us? And we changed it to healing humankind by alleviating suffering, promoting health, and delivering acts of kindness. So as an academic medical center, when this probably 15 years ago, saying we're kind was pretty unusual, but the patients responded in a really, really important way, and it changed everything at UCLA.
yeah, it's so fantastic. We got the same thing when we talked about leaders who care, and people would say, well, that's too intimate for business. Let's do this, let's do that. And then, fast forward, I had partners in the previous firm that said it's not business or whatnot. And I told them, well, when are you going to start thinking of when we start using the words kind and love? You're going to go crazy if you think care is too intimate. And I remember Joe Ma from Alibaba when they went public, and he said, America's got it all wrong. If you take care of your customers and your employees, everybody's going to win.
For sure. When I left UCLA to go to Geisinger, I thought, wow, for my professional development, I want to learn the payment side, because Geisinger, like a Kaiser Intermountain, they sell insurance and provide the care. Now, that's how the rest of the world does it, but there's only a few places in the US that do it. So I thought this would be a great experience for me. I did learn that. But what I learned that was much more important, because UCLA, we were really focused on that patient. At Geisinger, I learned what happens when you actually are in love with your community. And when you're in love with your community, and this is a community that doesn't move, right? So these people in northeastern Pennsylvania and central Pennsylvania are multi-generational. They've been there forever. They're not going anywhere. And if you love them, you start doing things that these are your people. Friday night, everyone is at the football game. Like, I mean, this was
Right.
small town for me, which was amazing. You create an insurance product because you want to make healthcare affordable. We created the largest biobank in the world of whole exome sequencing with return of results because we had multi-generational people. We, and this was actually my wife, started the fresh food pharmacy there that is serving millions of meals to type 2 diabetics and their families because it's better than metformin, and the kids now don't grow up and get type 2 diabetes. So that word love, I went to learn about insurance, and what the better lesson was how to love a community.
Well, you saw Dan Buettner at Lake Nona also with Blue Zones.
Yeah.
It's kind of like that. And then you're talking a little bit, and you know, the thing that I always found that fills people's hearts and souls more than anything is belonging. And
Yeah.
that's what you're giving them, and you know, trust and belonging. And it really is going back to basics almost, isn't it?
Oh, wow. I mean, when you think about it, when we talk about hospitals, the reasons we built hospitals because poor people couldn't get care at home. Now we don't want the poor people, if you're running a hospital, in your hospital, right? You want the one with the good insurance. Like we've lost our way. And back then, the original thing with hospitals that was the big problem was you were getting infections. Like nothing has changed. Like we're still worried about those things. Yes, some of the basics. I always say, people say, how do we, decrease or improve the health of America or decrease the cost and all that kind of stuff? It's just do the things our mom told us. Like if, and now not everyone can, but if you have the opportunity to eat well, to exercise, to have a sense of belonging, to have education, to be able to walk in your neighborhood, like that alone would decrease half of the people who are in the hospital tonight across America. Like we would have the biggest boom in our economy ever because healthcare costs would go down, wages would go up, people would be healthier, and they'd buy and shop and do all that stuff more. So a lot of this is back to basics.
Yeah, it's actually brilliant. There's a I don't know if you've ever heard of the Every Table restaurant
I have.
here in LA, and Sam
Yeah.
Polk that started that.
Yeah.
And in a way, it's a redistribution of wealth without redistributing it, basically.
Yeah. Yeah.
And it really gives people in food deserts the dignity of going into a place with their kids and buying a good meal that, you know, that maybe costs even less than McDonald's, and feeling great about themselves that they're doing it.
And when you talk to the mom who brings their kid, the single mom who's working 2 jobs, who's living paycheck to paycheck, who brings their kids to McDonald's, it's not as if they don't know that's bad food.
Right.
They're worn out. They say no to their kids all the time because they're so strapped financially. They need to feed them, and you get a toy. And so we've set it up that that's the obvious place to go. It is very hard to say to that mom, spend $5 on blueberries, and you may get home and a few of them are moldy, and they're not going to really fill you up in the same way. So it is a complex situation to kind of get back to basics. But the impact is, well, we saw it when we did it. I think it's now 5 million meals a year at Geisinger. The cost of healthcare for some of these people was $130,000 a year. Within 90 days, that dropped to $20,000. I mean, there is so much money. And the person who says, I'm a commercial truck driver, but I couldn't renew my license because my eyesight was so bad from the high blood sugar and the diabetes. Now that I'm healthy, I'm working again. I mean, it's this, it's a downward spiral. If you're sick, you start losing money. And if you're healthy, you start making money. So, I mean, yeah, I agree with you. It's pretty basic.
I was chatting with a lady in Thailand. They're doing stuff with very poor people, or poor people there, where they're trying to figure out a way to translate acts of kindness into points
I
that
love
will
it.
give them equal access to healthcare and even
Love it.
capital.
Love it. Love it. How cool is that?
And it's called like a program of kindness, basically.
Yeah, I love it.
And so I also saw Bill Maher was on the other day, not to get too far off here, but he was talking, and you reminded me when you said, you know, you're kind of defined by disease or by things like that last you. He went through all the topics of ADHD and anxiety and depression and all the different topics. There's tons of them that we define people at, and all the drugs are on TV to solve that. He said, why can't we just be okay with being sad 1 or 2 days? Why can't we just be this and that? Because the minute you start defining people on what issue they have or disease they have, and then they're defined, and that's something wrong with them, and then it gets worse, worse and worse.
Yeah. Well, and not to get too far off, but you said
All right.
there's only two countries in the world that have pharmaceuticals advertised on TV. It's us and New Zealand. I think there's only two countries in the world that are still on the imperial instead of the metric system, in us and Libya.
That too.
Yeah.
And it's only, I
So,
think, a couple of countries that still don't have an equal rights amendment literally for women to vote either.
yes, yes.
It's amazing what we do. So, well,
But we
a little
do,
bit.
I would push back a little as a psychiatrist on mental illness is just a mood fluctuation. There are definitely times where people are suffering. It's impacting their life, and it's more being sad and being anxious is normal, but depression and you know, obsessive compulsive disorder and bipolar disorder is not. And it's, so maybe he should stick to being a talk show host, and I'll do this.
Well, he interviewed a doctor before, and I'm not his agent, so I'm not defending him, but he did say each time there are people that need this,
Yes,
that are depressed and whatnot. He was, I guess, trying to make the point that we're defining younger people and other people so much on illnesses that, you know, it's kind of like the words we said before can really define you sometimes. And he was
yeah.
talking about all the advertising.
But ADHD is overdiagnosed and underdiagnosed, right? So if you're a rich kid and your parents want more time on the SAT and a little increased performance, there are clearly kids that do not meet the criteria that are on stimulant medication. And if you're a poor kid on the other side of the tracks and you have significant ADHD, it's oftentimes you can't get access to treatment. So it's both overdiagnosed and underdiagnosed. And I would say that's true in all this stuff.
Yeah. What a mess. Actually, you know, the fourth industrial revolution is speaking of defined, is kind of defined on technology, AI, virtual reality, etc. And they say the fifth is about humanity. We focus on impact and talent in our firm all the time because we find that the best people want to go work where leaders offer them good money and the chance to make a difference at the same time. And that's what great people want now. The pandemic showed us the dedication of healthcare workers and caregivers. And I know you've addressed different things in workforce and whatnot that are important, and their physical and mental health directly impacted their families, patients, the system, the communities. Can you share with us how you are addressing areas like burnout, as well as using data effectively to have a more connective ecosystem?
Yeah. So my sense of healthcare, to keep it simple, is people caring for people, and it's built on trust. And that's it. And the caregivers, and that could be a mom at home or someone taking care of their elderly parents, or it could be a nurse or a case manager or a doc or a social worker or the pharmacist, occupational therapist. I mean, it's broad. Technology has come in and in some ways done amazing things. mRNA vaccine. You know, we can now do MRIs and CAT scans and see things we couldn't see before. So I don't want to be anti-tech, but in healthcare operations, tech has come in and actually created a lot of problems. Docs are spending hours looking for information, recording information, being really pushed more around billing and coding than understanding their patient. Nurses are spending 50% of the time at the terminal, 30% of the time looking for supplies, and what I would say is 20% only doing actual nursing, right? So how are we addressing it? I think it's a huge problem. I've had the opportunity to literally travel around the world and meet with our customers, and everyone starts with, well, we know it's different in the US, but here are our problems. And then they list the exact same problems we're having. Like, so this is global, although no one knows that, right? We just launched a product at Oracle called Oracle Clinical Digital Assistant. And it's now been in use thousands of times. It'll be hundreds of thousands of times in the next month. Here's what happens. I go to see a new patient. Let's pretend I'm an outpatient doctor. And I say, hey, Oracle, tell me about Mrs. Smith. Now, what I get is a summary about her from multiple electronic health records, including disparate data sets like she lives in a food desert. She's near a forest. There might be a higher incidence of Lyme's disease, right? So what normally would take a medical student 5 or 6 hours gets done in a second.
Yeah.
And it's even better because it's more data. Okay, so I get a summary about this patient that I'm about to see. And then I go in and let's pretend Mrs. Smith has given me permission to record the visit. And I put my phone down and I say, hey, is your pneumonia getting better? How's the cough? Are you still using the inhalers? She asked me some questions. It seems like her diabetes is getting out of control. And I'm like, hey, Oracle, can you tell me Mrs. Smith's last hemoglobin A1Cs? And right when I need it, I get that information. Okay, the visit's over, and we decided that she should be enrolled in a food prescription program. I'm going to increase her metformin for the diabetes. The pneumonia seems better, but let's check a hemoglobin A1C, a measure of blood sugar, in 3 months. Done. Now, I've never touched the computer, and the AI has now changed the prescription, enrolled her in the program, written the note, done the coding, and her sister's actually a medical personnel, and she wanted her to get a note that explained it. I could send a note to the sister in the right level of medical ease, and the lay persons to Mrs. Smith.
Wow.
Never touched the computer, right? When people say, what do you think in the future? I'm like, the future is here.
Right.
This is
Exactly.
happening right now with docs, and I get emails that go like this. I had lunch 3 times this week. I have not had lunch in 6 years, Dr. So-and-so. I got home at 5:30. I didn't know what to do. You know, I saw 3 more patients. This is amazing. Now, I've not seen responses like that when you put tech into healthcare workforce, right? That we don't want to do the training, we don't like this. And hey, I'm that doc, I've done that. Those things can be a pain. So these tools are amazing. Now, a bunch of issues. Every one of those things, in my example, the note, the prescription change, the enrolling the patient, the setting up her next laboratories, we put human in the loop. This is what the computer says. You agree? Yes. Do you want, is this the order you wanted? Yes, 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 yes. So not perfect, but we're talking the biggest change I've seen in physician workforce workflow ever in my career. And
It sounds like you're letting humans be more human because of the tech.
We're letting people care for people, and we're bringing the tech. Leave that to us, and we'll give you the tech just when you need it, and the tech will do work for you. Think about a nurse, traveling nurse, gets to a hospital, right, and is told this patient needs chemo and has never done chemotherapy before. Well, we now can bring that from our human capital management into the electronic health record, so you have just-in-time training, where the doctor in the operating room is done, you got your hip replaced, but it hasn't ever been connected to supply chain, so that next week we have the right stuff in the OR. That's what we're building. We're doing it in a way that first and foremost, I like to say this to the team. So Oracle Health bought the company that I had the opportunity of running called Cerner, which is the largest electronic health record company in the world by far. When we're done with the VA rollout in the US, we're again the biggest in the US as well. And what I say to the team is, you know what that means? That means we have more of grandma's blood sugar than anyone else. So what do we want to do with grandma's blood sugar? Well, the first thing we have to do is keep it secure, right? From a cyber standpoint, you can't care for people if they don't trust you. Right. You can't care for people if they think this sensitive information is in the wrong hands. So it's first about security, and then it's about moving that information around at the right time so we can do the right thing and make sure grandma has food in her cupboard and make sure that the daughter who's helping her knows what's going on with the insulin. Like, it's a very, very responsible position that we're in. And we have to treat that as if it is our grandma's blood sugar. So that's what we're doing at Oracle Health. And I keep telling people, this is the second best job I've ever had. My first is actually taking care of patients with ADHD and autism. And I'm probably not good at that anymore because I haven't done it in a while. But as far as all these administrative roles I've had, I see this opportunity now with this entire group of assets we have: cloud, back office, claims, clinical trials, electronic health record, amazing technology that's, that all of us have now. And the world needs it. Like, COVID was like a public health lesson for the whole world.
Yeah.
That was terrible, but hey, now people understand what we're talking about. The hospitals and health systems are hurting. The docs and nurses are burnt out. We have an opportunity to show up and actually allow them to do their thing, which is take care of their friends and neighbors.
Yeah, I had a friend who was he had an urgent care center. He was an MD and everything. He ended up selling it. This is a number of years ago because he wasn't able to spend as much time with his patients as he wanted to.
Yeah.
So, I get it. It's amazing the depth and the breadth of everything you're involved in Oracle Health. Reading about the first Bermudian with an entire digital record, then the U.S. DoD military treatment facilities. I just kept reading because it was like fascinating to me. And then it really hit home when you got into Canada with the 1 million Nova Scotianers, for what was the one person, one record modernization to improve care for 1 million people in Nova Scotia. And then to the UAE. I mean, it must feel really good based on what you care about to see a real impact on real people. And the fact that economics allows it to happen.
Yeah, I mean, it's beyond my wildest dreams, but back to being grounded and with all humility, I think all I'm doing and the team is doing is trying to get information to people in a way they understand and try to make access better and try to make it easier to be a doc or a nurse or a caregiver. That's all we're doing. Now, when you can do it at scale like this, it gives me goosebumps. Like, it's like amazing. It's absolutely amazing.
Yeah, it's super exciting. That healthcare is probably the arena, the sector that can have the most impact on people, AI having the most impact on people by far.
Now, we got to be really careful.
Right.
When I was at Google with the NHS, which is a big Cerner customer on top of Cerner, we did this thing to try to improve the ability of the nurses and the doctors in the hospital that are the rapid response team. Patients are in the hospital and they get sick. We tried to improve their ability to care for those patients. So we created this app that showed if creatinine went up, and creatinine is just a measure of kidney function. And if the creatinine went up, they went and saw the patient. So normally it was taking them 4 hours to diagnose acute kidney injury in the hospital. And now with this good app, it went down to 14 minutes. There were 30% less cardiac arrests, and there was a 17% decrease in the cost of care. That's just UX. That's not AI. Then we said, okay, instead of creatinine, what if we let the computer learn about this? And we trained the computer on 70,000 patients, 600,000 variables per patient. And we said, hey, computer, can you tell us when someone's going to have acute kidney injury? Now, normally it was 4 hours. Good handheld application took it to 14 minutes. The computer figured it out in negative 48 hours. 2 days before the patient had anything wrong with them, anything. With 90% accuracy, they could predict the patient was going to be on dialysis. So, like, as a doc, you wouldn't even know what to do. Like, the patient looks great, but in 2 days they're going to be deathly ill. Well, I guess I would make sure their fluids are okay, and maybe if they're on some medicine that's affecting their kidney, I'd think twice. But it's almost this dawning of anticipatory medicine where this AI can literally write your electronic health record for the next 10 years and be pretty accurate. Okay, so that's the amazing thing. But those 70,000 patients we trained it on were actually is in partnership with VA here in the US. Well, they're 93% male. When we then use the same algorithm in a general population, 50% male, 50% female, it's
Mhm.
way less accurate.
Right.
So great. Now let's train it on that population so we know what to do. But as these things come out super fast, we have to be careful that we're using them in the right situation and not taking the bias. And in this case, we knew there was bias. We were biased because that's the data set we trained it on, that it was more male. Then we have to be super careful that we're not using it in the wrong situation. So yes, the future's here, but I don't want to be on your podcast or your video in 4 or 5 years ago. Man, we screwed up. So we gotta really think this thing through.
Yeah, and you know, you talked about a biggie before a few times, trust, and I think what an opportunity for different communities, different diversities to finally gain 100% trust in healthcare. For example, with the vaccine in the Black community, because of previous experiences, to gain the trust in healthcare that will help everybody so much because of gaining the trust in healthcare.
Yeah, we have a thing called the Learning Health Network, which is basically our customers say they want to join, and there's no fee to join, but they turn over their de-identified data, and in return, they get access to all the de-identified data, and some great research is coming out of it. We also use it as a way to enroll patients in studies for medications or diagnostics. It's over 100 million records. It has 3 times the diversity of any national data set in the United States. I think diversity is its superpower, right? So now what does that mean? That means small hospitals. We're both in California. I'll give you a California example. San Joaquin Hospital. Okay, this is not UC San Francisco or Stanford or Cedars or UCLA. This is farm country. Had never done a clinical trial. They're on their 3rd cardiac trial. Osmond, Nebraska. It has a population, if you didn't know, of 800 people. It has a small little hospital.
I did not know.
They're doing colorectal trials there. So half of our Learning Health Network membership is research naive. What does that mean? It means we are bringing infrastructure to rural and small town America for clinical and diagnostic trials. So we're getting better diversity in the data set. Plus, if these things prove to be effective, now those docs and health systems are going to be much more comfortable using them. They were part of the trial. It can sometimes take 20 years for something to get from the academic medical center to, Bakersfield or Lancaster, if you're talking here in California, and it's only 90 miles away. But things travel slow as far as academics go. We're trying to change that by building infrastructure to all of America. Actually, we're taking this global, but in
Sure.
this case, to all of America.
And it's super exciting, and I know we only have so much time. So like we say in LA, we have to keep them wanting more so we can do a sequel. We're definitely gonna have to do a sequel, apparently. But one thing I want to add to that is, there's a term soft skills, and I've seen it in the healthcare industry we work in, but also every other industry. And I used to not like that term. We've kind of changed it to power skills, because with AI coming in, all the things you're talking about, obviously you have to have the knowledge, and you're having access to the knowledge now. But those power, previously known as soft skills, are going to be more and more and more important for every healthcare professional, every professional out there, and how they're dealing with each other, how they're dealing with patients, how they're dealing, I would think. What comments on that?
Yeah, I mean, we talk about healthcare as an art and a science. The science is going really fast. It's in some ways taken us a way of holding the patient's hand
Right.
and saying, we got 3 options. Now, maybe the AI helped me really understand those, but we got to talk about what you want to do. And it's a big decision. And I think this is going to give us the time and the breath to actually do what you're talking about, whether it's soft skills. I call it caring, or loving.
Well, that's why this is called the Leaders Who Care
Oh, there
series.
you go. There you go. So we're going to do more caring, because I think we've figured out some ways to make the technology work for us instead of vice versa.
Yeah, it's brilliant. Really kind of quick, with everything that's gone on with the pandemic and all the way to now, and fast moving everything, what are you most grateful for, and what are you most hopeful for?
The thing that I'm most, I don't know that I'm going to use either of your words. The thing that upsets me the most is the care that's different for different types of people. Those gaps that you can be 2 stops away on the L in Chicago, or you could be in East Palo Alto versus Palo Alto, go to the same doctors and hospitals, and yet you're going to die 25 years earlier. Like that drives me crazy. Well, I'll try to make it positive because you want it positive. I'm hopeful we fix that.
Well, that's hopeful. We fixed that.
I'm hopeful that we fix that. I'm grateful. This is probably weird to say, but I'm grateful for COVID because I think it brought it out to the public in a way that the public didn't know before. So maybe that will give us a better shot at actually fixing it. That, you know, in child psychiatry, I had a teacher who would say jokingly, pick your parents wisely and you'll do well. Some people don't get the opportunity to pick their parents wisely. They got born on the wrong side of the tracks. That
Right.
means their health outcomes are going to be terrible. I'm hopeful we see that now in a way we haven't seen it before and address it in a way we haven't addressed it.
Yeah, beautiful. Well, I'm certainly grateful that you're a leader who cares, and we need more. We definitely need more caring, and that's what I'm hopeful for too. So, and we'll have to have a sequel. But thank you so much for sharing and being a leader who cares. Really appreciate it.
My pleasure. Thanks, Mark. Enjoyed the conversation.